Hey everyone, welcome to It's Time, the podcast where we explore, well, the big messy world of healthcare systems and everything in between. I'm David Caldwell, and let's just say I'm playing the role of the curious outsider here.
And I'm Dr. Sophia Ramirez. I bring the, slightly nerdy healthcare perspective. But don't worry, we'll keep things fun. After all, we're diving into one of the most important challenges of our time.
So, before we really get started, we do have a quick disclaimer. Ready for it?
We are AI-generated hosts with AI-generated text. And this is important, there is a real person behind all of this, Dr. Chad Swanson, who's an emergency doctor.
Yeah, it's wild stuff, right? But I promise this conversation is packed with ideas, insight, and a whole lot of things you probably haven't thought about when it comes to healthcare.
Exactly. So whether you're a policymaker, a healthcare worker, or just someone who wonders why things feel so complicated when you're sitting in a waiting room.
This podcast is for you.
All right, ready to jump in?
Totally. Let's get started.
All right. As we dive in, I can't help but think about how so much of our healthcare system, like so many things, is built on a shared vision, or maybe even a series of shared visions over time. It's like looking back at how this country was founded, these bold, imperfect ideas of freedom and human rights. What kept it all moving forward was belief, right? The belief in progress and in building towards something greater.
Yeah, but if you think about it, a vision like that is, I don't know, it's so broad. How do people get from a big idea to something tangible, like actually making it work?
Great question. Take something like smartphones. Decades ago, there was this shared vision among innovators, people like Steve Jobs and others, of creating a product that billions of people would want to own. It started small, but that shared vision kept evolving. They worked towards it relentlessly. And here we are today, unable to imagine life without them.
Exactly, how did humanity even survive without group chats, right?
Well, it's fascinating to me because it shows us what happens when people commit to creating something transformative. And historically, you see it in social movements too, like women's suffrage or civil rights. These were monumental changes born out of a shared vision for justice and equality.
Man, that's powerful stuff. But when we're talking about today, especially healthcare, what does it look like to have a shared vision there? Or do we even have one right now?
That's where it gets tricky. Peter Senge, who's, kind of a guru on this idea of shared vision. He talks about it as more than just a plan or a goal. He says it's about aligning people's passion, their aspirations, so they're actively pulling in the same direction. And I can't help but feel that's what we're missing when we talk about healthcare today. What actually is the vision we're all supposed to be working toward?
Yeah, because it feels, kind of fragmented, right? It's like instead of one big shared vision, we've got competing mini visions that don't really align. Is that fair to say?
Oh, absolutely. And even when you ask people, from policymakers to, frontline healthcare workers, what their vision is for the healthcare system, the answers are all over the place. Quality care for everyone, sustainability, efficiency.
But no one's really tying it all together into this cohesive thing. It's like they forgot about the power of a shared vision entirely.
This got me thinking about the nature of vision itself, what really defines it. Corporations and organizations, for example, they love to show off their fancy vision statements. You've seen them, right? We strive to be the world leader in X, or our mission is to make every customer smile. But here's the thing. The real vision isn't just what they say. It's what they actually do. And maybe that's part of why healthcare feels so fragmented. It lacks that alignment between words and actions.
Wait, so it's less about the words they put on a website and more about their actions?
Exactly. What do they prioritize? For example, what are they measuring? Numbers like profits, customer satisfaction, or global reach? Those tell you a lot about where their focus is. Then what are they incentivizing? Whether that's financial rewards or even cultural recognition.
So actions, measurements, and incentives. Do you mean how they motivate people?
Yes, exactly. Motives play a huge role. Are they motivated by growth, by innovation, or by something more altruistic like serving the public good?
Right, but this could apply to more than just corporations, right? What about a basketball team?
Oh, it works beautifully for sports. A basketball team might say on paper that their vision is to win championships. But their actual vision is baked into what they do. Are they focused on building a cohesive team on scouting and investing in young players? Or are they fixated on ticket sales and broadcasting deals? Watch their actions, and you'll see what they're really about.
I mean, it makes sense. Or a political party.
Yes, political parties are a great example. Their vision can look broad, like, we represent the people, but what gets measured? Election wins, fundraising totals, social media influence? Those behaviors and metrics tell you what they're really motivated by.
Okay, I've got one. A party for a 10-year-old. Bear with me here.
All right, let's hear it.
So the parents say their vision is to create an unforgettable day. But what do? Are they organizing games for all the kids to play together? Or are they more about the Instagram-worthy cake and decorations? The real vision emerges from those choices.
Exactly. And when we bring this back to healthcare.
Oh no, here we go.
No, but seriously, what's the vision of our healthcare system? If we judge it by the same questions, what do they do, measure, incentivize, and what motivates them? What would we see? All right, David, thinking about your party example from earlier, or even that basketball team, what would you say is the vision of our healthcare system today? Whether it's clinics, hospitals, public health, or even education, what do you think those actions and priorities reveal?
Oh man, that's tough. I mean, if I had to guess, I'd say something like giving people access to care, or maybe improving health outcomes. But it doesn't really feel clear, does it?
Exactly. And that's what makes this so striking. When you start examining it from different perspectives, let's say a pharmaceutical company versus a public health agency, you realize that everyone seems to be operating with their own agenda. And honestly, sometimes it feels like even patients are an afterthought in all of this.
Oof, that's pretty intense. But instead of a focus on patients or communities, what do you think is actually driving the system?
If I had to pinpoint it, I'd say a mix of episodic treatment, profit motives, and unfortunately, elitism.
Wait, elitism? Do you mean like gatekeeping and who gets to participate or benefit from the system?
Exactly. Think about this. Healthcare is often treated as a privilege instead of a right. And the priorities reflect that because everything, from medical education to policymaking, centers around maintaining the status quo that benefits, well, the few. The few with resources, the few with connections. You get the idea.
Yeah, it really does feel like there's this disconnect between the big picture goals and the day-to-day reality. But how did we get here? Why don't we have a cohesive, shared vision?
That's the million-dollar question, isn't it? I mean, shared visions aren't magic. They require people to come together, align their values, and agree on what success looks like. And here, we haven't done that. Or, if we've tried to, it hasn't stuck.
And without that shared vision, it's just people pulling in 100 different directions. Got it.
Exactly. But the thing is, this isn't just a recent problem. Much of what shapes our system today comes from assumptions and structures that were established over a century ago. And it's not just our ideas about healthcare that have evolved since then. Right. And those structures and assumptions, many of them over a century old, continue to shape everything we experience in healthcare today. It's like we're wrestling with ideas and frameworks that might have made sense back then, but feel completely mismatched now.
Wait, 100 years? That's wild. I mean, so much has changed in a century. What does it even mean to rely on ideas that old?
Exactly. Back then, the medical field was just starting to professionalize, and our understanding of diseases was, pretty rudimentary. Things like antibiotics didn't exist yet. Vaccines were in their infancy. It was a completely different world.
Right? And today we've got the internet, telemedicine, AI models predicting diseases. It's hard to imagine how much has shifted.
Yeah, and it's not just the technology and science. Think about the social context. We've had these massive changes in epidemiology, like how chronic diseases have replaced infectious diseases as the leading causes of death. And then there's racism, sexism, and the ways those forces have shaped access to care and health outcomes even to this day.
So, while everything around us has evolved, we're kind of stuck with this old healthcare foundation?
Exactly. Institutions, roles, incentives, much of it was designed for a different time. And that creates this tension, because it's like we're trying to solve today's problems with yesterday's tools.
And those old tools, are they working?
Not really. I mean, sure, they've adapted here and there, but the basic assumptions we're working with, they're outdated. And it's not just about the tools or the infrastructure. It's also about the mental models, the way we think about healthcare and what it's supposed to do.
Yeah, I mean, if racism, sexism, all these systemic issues are baked in from the start, it's like, how do you move past that?
Well, that's the question, isn't it? You can't really move forward unless you confront what's holding you back. And that means re-examining the assumptions we've inherited.
So, what were those assumptions exactly? Like, what were they thinking 100 years ago when they built this thing?
Well, for starters, there was this idea that healthcare was episodic, that it was something you needed when you were sick, and then you'd recover and be done with it. Prevention, public health, those were seen as, well, separate from the system itself.
Which makes sense for that time, right? But now it's all,
Exactly. It's changed. And yet, so much of our system still operates as if the world hasn't moved on. So, thinking about those outdated assumptions in healthcare, here's something fascinating. When we talk about vision in healthcare, most people instinctively focus on clinical care, doctors, hospitals, treatments. And that's important, of course. But what if I told you more than 80% of what shapes our health happens outside those walls?
wait, really? 80%? That's wild. So, if it's not the doctors or medicines, what is it?
It's everything else. Things like where you live, the food you eat, your income, early childhood experiences. It's often called the social determinants of health. And it shifts the focus away from, just treating disease to actually shaping environments where health can thrive.
Okay, so it's kind of like saying, instead of planning how to put out a fire, you're trying to make the house less flammable in the first place?
Exactly. Prevention, access to resources, stable housing, it's all part of the equation. And here's the kicker. Health itself isn't just about an episode of care. It's a journey we travel on, often with many other people along the way.
That's such a shift, right? I mean, we treat it like something you dip in and out of, like you get sick, you get treated, and bam, done.
Right. But in reality, our lives move through these complex systems, friends, families, communities, workspaces, policies. And the truth is, the healthcare system isn't just insurance companies or government programs either. It's all the people, organizations, and social forces that influence our well-being.
You're blowing my mind here. So, what you're saying is, if we're trying to build a vision for healthcare, it's not enough to think about medicine alone. It's got to be bigger picture, right?
Absolutely. If we're really serious about this, the vision has to encompass not just how we treat patients, but how we create conditions for health in the first place. And that's where the challenge gets real. So, David, as we think about creating those conditions for health that we talked about, let's dive into equity in healthcare. It's one of those words that gets thrown around a lot, but the reality is, it's incredibly complex. At its core, though, it's about fairness. But fairness doesn't always mean equal, right?
Yeah, that's interesting. So, when we're talking about equity, we're not saying everyone gets the exact same thing. But what? That people get what they need?
Exactly. It's recognizing that different people face different barriers to health. For example, someone in a rural area might not have the same access to specialists as someone in a city. Equity means addressing those disparities and creating systems that account for them, so everyone has a fair shot at being healthy.
Okay, but what does that actually look like? I mean, how do you create fairness in something as huge as healthcare?
Good question. Sometimes it's about reallocating resources where they're needed most. For instance, more funding and infrastructure in underserved communities, or policies that eliminate systemic barriers, like improving language access for non-English speakers. And we have to acknowledge...
Here it comes.
All right, hear me out. We need to acknowledge that our healthcare system wasn't designed with equity in mind. Historically, most structures benefited those who already had privilege, wealth, education, even geographic location.
So, it's like the deck's been stacked from the start, and now we're trying to reshuffle without tearing the whole thing down?
Exactly. And think about how this plays out in something like maternal mortality rates. In the U.S., Black women are 3 to 4 times more likely to die from pregnancy-related causes than white women. That's not because they're less healthy. It's because structural inequities, like bias in care and lack of access, put them at greater risk.
Wow. That really hits hard. So, fixing this, it's not just about throwing more money at the system, right?
Exactly. It's about addressing the root causes, things like systemic racism, poverty, and unequal access. And that requires bold policies, organizational changes, and honestly, a complete rethink of how we measure success in healthcare.
Okay, but here's a thought. If we're saying that health outcomes can be so skewed by inequities, doesn't that make the system kind of inefficient in the long run?
That's a great point, David. These inefficiencies created by inequities really highlight a bigger issue in healthcare, how we define and strive for efficiency overall. There's a tension between short-term fixes and long-term systemic improvements that often gets overlooked.
Wait, what does that even mean? Like you can save time now, but it ends up costing more later?
Exactly. Let's say we focus on speeding up patient visits to make the process more efficient. Sure, we save time in the short term, but if those quicker visits miss key issues or opportunities for prevention, then long term, the system might spend more money dealing with complications that could have been avoided.
Ah, right. So it's like taking a shortcut that ends up being a dead end?
That's a perfect metaphor. Efficiency, at its best, has to balance both short-term gains and long-term sustainability. And then there's allocative efficiency.
Okay, hang on. What does allocative efficiency even mean?
Fair enough. Think of it like making sure the right resources go to the right places. So, in healthcare, that might mean allocating more funding to primary care or public health interventions because they provide the biggest overall benefit to society.
Got it. And I'm guessing we're not doing so great on that front.
Not really. We tend to focus more on administrative efficiencies, things like reducing paperwork or streamlining billing. And while important, they don't always translate to better clinical efficiency, which is where it really matters, improving patient outcomes and care delivery.
So, two kinds of efficiency, right? Administrative versus clinical. And it sounds like one's dragging the other down?
In many ways, yes. Administrative efficiency often focuses on reducing costs and optimizing operations. But clinical efficiency is about using time, resources, and expertise in ways that directly benefit patient care. Sometimes the priorities clash.
Okay, but you know me. I'm all about the gizmos and gadgets. What about technology? Isn't innovation supposed to make everything more efficient?
Oh, absolutely. But it's not just about the technology itself. Efficiency through innovation also means rethinking roles and institutional policies. For example, allowing nurse practitioners or physician assistants to take on more primary care roles can help address workforce shortages and improve access to care.
Right, so you're not just swapping out one expensive thing for another. You're actually reimagining how the whole system works?
Exactly. And sometimes it's about adjusting policies to support these changes. For instance, telemedicine. Huge potential for efficiency there. But if reimbursement models don't incentivize its use, well, we're kind of stuck spinning our wheels.
So, it's not just about inventing cool tech, but making sure the system is set up to actually use it effectively?
Exactly, David. Efficiency doesn't just happen. It requires deliberate choices, innovation, and honestly, some pretty bold leadership. You know, David, when it comes to healthcare transformation, bold leadership and innovation are just the starting point. But those efforts can only take us so far without a shared vision. It's less about making perfect moves like in chess, and more like piecing together a never-ending puzzle, collaborating, adjusting, and remaining dedicated to what really matters.
Yeah, relentless. I really like that word. It's not about working nonstop though, right? It's about staying committed. Not giving up when things feel stuck or overwhelming.
Exactly. It's about creating this momentum, you know? Once a vision takes hold and enough people align with it, big things can happen. And the thing about complex systems is, they don't always change gradually. Sometimes the shift is sudden, almost like a tidal wave.
Right? Like you don't see it building up, but then bam, it's there. The big change happens.
Exactly. But that tidal wave, it doesn't come out of nowhere. It's built on years, decades even, of relentless effort, people pushing, advocating, never giving up on that shared vision.
Man, that's powerful. But also a little intimidating, don't you think? Like, can we really get there? I mean, the system's so big and, well, messy.
It is messy, David, I won't lie, but history shows us that relentless visionaries, whether it's in healthcare, civil rights, even tech innovation, have changed the world before. Not by themselves, but by inspiring others to join them.
So you're saying it's not about finding the perfect plan right now. It's about committing to the process and just not giving up.
Exactly. We don't need perfect, we need progress. And progress comes from relentless, collective action. If enough of us push in the same direction, David, I truly believe we can make a difference.
I I really believe that too. And hey, maybe these conversations we're having here, maybe this is part of that shared vision, you know?
It absolutely is. Every discussion, every idea exchanged, it all contributes to building that momentum, which is why we'll keep having them here on this podcast, exploring things from every angle.
All right, well, on that note, I guess it's time to wrap up. Sophia, this has been incredible, as always. And to all of you listening, thank you. Let's keep this conversation going.
Yes. And remember, big change starts with small steps. Until next time, folks, be relentless.